All right. Well, hi everyone. Welcome to our smoking cessation webinar. If you have come to learn a bit more about why you should quit or perhaps how you should quit, then you've come to the right video. Today we'll be walking you through those different steps and hopefully you'll learn a little bit as we spend time together. So before we jump into all the heavy info, we just want to provide a bit of information about exactly who we are.
Hi, so I'm Victoria. I'm a current McMaster Health Sciences student in my second year. I just started at the clinic this March actually, so I haven't been able to go in person yet, but I'm currently helping with extra clinical volunteering like workshops and book editing, so expect to be hearing more from me.
And my name is Winnie. I'm a recent graduate from the same program as Victoria, actually, the health sciences program at McMaster. Right now, I'm helping with phone appointments remotely and also just helping out with webinars like the one that you're watching right now.
So before we start, we're just going to be talking about what we'll be talking about today. So as you can see on the slide, there's 5 major topics. The most of it will be the first two. So the first one is why you should quit smoking, and we'll be talking about the effects, some myths about quitting, and the benefits of quitting. And then we'll be talking about how you quit and what it involves, such as the obstacles, some strategies and steps, and treatments. And finally, at the end, we'll be talking about some resources that can help you in a summary of the overall quit plan, and finally what to do in case you relapse. So if you're watching this workshop titled Smoking Cessation, I'm sure that you're quite familiar with the whole idea that smoking is bad. So whether you yourself smoke or one of your loved ones smokes, you taking the time to watch a smoking cessation workshop means that you're aware that smoking is harmful and you want to take action to change that. However, as we'll talk more about later on, in spite of wanting to quit smoking, a lot of people have trouble fully committing. And so whether that's because of procrastination in starting or relapse after starting. And a huge part of committing to quitting is knowing, believing in, and reminding yourself of why you want to quit. So we'll start off our workshop with exploring the effects of smoking, especially in the context of disease. So smoking is the leading cause of preventable premature death globally and in Canada. And in spite of only seeming to come in contact with your respiratory system, smoking affects almost all bodily systems and increases the risk of diseases affecting many parts of the body. Starting with the lungs, smoking directly damages the lungs when you inhale all the harmful chemicals in tobacco smoke, including lead, arsenic, and radioactive elements like uranium. So it logically follows that smoking increases your risk for many different lung diseases. But the most notable of these is chronic obstructive pulmonary disease, or COPD. And just to give a bit of context, then COPD refers to a group of diseases that causes airflow blockage and breathing-related problems like bronchitis. And if you'd like to learn more, we have more workshops dedicated just to COPD on our YouTube channel. But what's really shocking about smoking in COPD is that smoking is the leading cause for COPD. And in fact, lifelong smokers have a 50% probability of developing COPD in their lifetime. And on top of that, smoking also increases the risk of cancer in more than 15 different parts of the body, including the lungs, pancreas, bone marrow, kidney, cervix, bladder, and stomach, just to name a few. But if we narrow in on the lungs, smoking multiplies your risk of lung cancer by 25 times. And this is even slightly higher for women, with female smokers having a 25.7 times higher risk of lung cancer than non-smokers. And something very relevant to our current situation is that Public Health Ontario released a report in July this year stating that there is some evidence that smoking may be associated with increased severity of COVID-19 if you contract it, and if you're hospitalized, being a smoker is also associated with increased risk of death. And other than the lungs, then smoking is also associated with increased risk of heart disease, stroke, and diabetes, as well as weakening of the immune system, which can result in rheumatoid arthritis. And if you're currently looking to have children, you should also know that smoking is associated with fertility issues for both men and women. However, smoking doesn't only impact the person holding the cigarette. Secondhand smoke, which is when other people around the smoker inhale tobacco smoke, is also incredibly harmful, even in small or short exposures. Among adults, secondhand smoke is associated with increased risk of stroke, lung cancer, and coronary heart disease. And specifically, non-smokers who breathe secondhand smoke at home or at work increase their risk of developing heart disease by 25 to 30%, and they also increase the risk of stroke by 20 to 30%. Children who are exposed to secondhand smoke are at increased risk of a sudden infant death syndrome, acute respiratory infections, middle ear disease, more severe asthma, respiratory symptoms, and slowed lung growth.
Next, we'll just be jumping into a couple of myths about quitting smoking. So starting on this journey, you might already have some information available, but we just want to clarify exactly why, what some of these truths are, basically. So one of the first myths that's the most common is that we hear there isn't much harm in smoking only a few cigarettes a day, maybe like 3, 4, 5. But in actuality, just smoking a couple cigarettes already significantly increases your risk of heart disease, cancer, respiratory illnesses, just like Victoria was talking about just now. So small quantity does not mean you're not at risk. Secondly, we often hear that nicotine is the main toxic component of cigarettes. That is not quite true because nicotine is actually the addictive substance. It's what gives you that high when you smoke. But in actuality, it's the other 70 plus chemicals in cigarettes, such as tar and carbon monoxide, that actually damage your body the most and lead to those illnesses. A third myth that we hear is that light cigarettes are safer. I'm not sure if they're called light cigarettes here in Canada, but I think they may be called like silver or white. It's basically an advertising gimmick by a lot of tobacco companies, because in actuality, even though they supposedly contain smaller amounts of tobacco, smokers often take longer or deeper puffs from these cigarettes. And as a result, you're really just breathing in the same amount of those chemicals that are harmful to you. So it doesn't change much, even though it's supposedly a lighter cigarette. And then lastly, this might be relevant. At some point, maybe you thought it was too late for you to quit, or there's no point in quitting now. I'm already in my 60s, 70s, 80s, whatever. But in actuality, it's really never too late to quit. And as you'll hear soon from Victoria, the benefits really start within days of quitting.
Yeah, so now that Winnie talked about some of the myths about quitting, then I'll be going into the benefits. So as you can see on this timeline, then the positive effects of smoking can take place within anywhere as short as 20 minutes up to 15 years. So specifically within 20 minutes of quitting, your heart and blood pressure both drop. And 12 to 24 hours after quitting, then the carbon monoxide level in your blood drops to normal, and your risk of having a heart attack also begins to drop. Within 2 to 3 months after quitting, your circulation improves and your lung function increases, and your lung function begins to improve. And then 1 to 9 months after quitting, you cough less and your lungs work better. 1 year after quitting, your added risk of smoking-related heart disease or stroke is cut in half. So in other words, I mentioned before that smokers have a much higher risk of heart disease or stroke. So this added risk is basically decreased by half within 1 year after quitting. 5 to 15 years after quitting, your risk of stroke is lowered to the same as someone who has never smoked before. And then your risk of getting cancer of the mouth, throat, or esophagus is also half of that of the smokers. So in other words, 5 to 15 years before, 5 to 15 years before that point. So when you start or before you quit. And 10 years after quitting, your risk of dying from lung cancer drops by half. Your risk of getting bladder cancer is half of that of the smokers, and your risk of getting cervical cancer or cancer of the larynx, kidney, or pancreas also decreases. And finally, 15 years after quitting, your risk of coronary heart disease is lowered to that of a non-smoker. And finally, although the exact timeline for this is inconclusive, if you want to have children, it's also important to know that quitting smoking reduces the chance of impotence, having difficulty getting pregnant, having premature births, and general complications with fertility or having children.
I've also heard that if you do smoke now, even if you're no longer planning on having children, you're just less likely to perform sexually, like erectile dysfunction for males. and lower libido for females is also like a risk of long-term smoking, apparently.
Yeah, for
Yeah,
sure.
but anyway, this just goes to show, even if you're older and you've been smoking for 50 years, even if you quit now, you still experience a lot of these benefits. Although who knows, maybe you'll live another 10 years and you'll experience these benefits as well.
Yeah. And if you quit smoking, you're more likely to get to that point too. So now let's translate all of these benefits into life expectancy. So when you mentioned before that, a lot of the lack of motivation to quit smoking might come from you already being at like a late point in your life. So we're just gonna be so regardless of what age you are, you still do gain a lot of life expectancy. So if you quit at about 30 years old, you gain almost 10 years of life expectancy. If you quit at about 40 years old, you gain 9 years of life expectancy. At about 50 years old, you gain 6 years. And at about 60 years old, you gain 3 years of life expectancy. However, what's also really interesting about quitting smoking is if you quit after the onset of a life-threatening disease, then you have a really, really rapid benefit. So for example, people who quit smoking after having a heart attack reduce their chances of having another heart attack by 50%. So now, how do you quit smoking and what does it involve? Before we discuss strategies to quit, we want to reiterate that smoking tobacco is both a physical addiction and a psychological habit. So you need to be prepared to face and overcome both physical and psychological effects when you're attempting to quit. So smoking is considered a physical addiction. Sorry, can you go back to the last
Yeah,
slide?
sure thing. Sorry.
Yeah, no, it's okay. So physical is considered smoking is considered a physical addiction because the nicotine from cigarettes provides an addictive high, like Nicotine mentioned before. And eliminating that regular fix of nicotine causes your body to experience physical withdrawal symptoms and cravings because your body has become used to and has physically adjusted its internal processes to expect and rely on a steady external supply of nicotine. And smoking is also considered a psychological habit because it's ingrained as a daily ritual. So it might be an automatic response for you to smoke a cigarette with your morning coffee at the end of each meal or to unwind from a stressful day. And so to successfully stop smoking, you'll need to address both the addiction and the habits and the routines that go along with it. And to support you all in doing that, we'll be discussing strategies and resources you can use to counteract the psychological effects, as well as medications that currently exist to prevent and address withdrawal symptoms of the physical addiction. So now, there's a lot of different strategies and recommendations for quitting smoking out there, but we tried to synthesize all of them into like 3 sets of 3 steps. Like the rule of threes. So our first one. So our first. Actually, we have a cute little alliteration. Plan, prepare, and pursue. So for our first, I guess, phase of planning, then we'll be talking about writing down your reasons for quitting, setting a quit date, and considering different ways to quit. And then in the prepare stage, so basically looking into other resources to help you in your, I guess, like journey of becoming smoke-free. Then we have writing down your reasons for quitting, setting a quit date, and considering other ways to quit. And finally, we'll be talking about how to pursue smoking cessation. And it sounds like it kind of sounds like, oh, like how do I start smoking cessation? But what we mean is how you stay motivated and how you stay on track. And so this can include avoiding smoking triggers and reshaping your routine, as well as managing cigarette cravings, and finally celebrating your successes. And then we'll be discussing some resources to help with all these steps after we've explained each of them. So our first phase, planning, is all about deciding why and when you're going to quit. So let's say you decide to quit smoking. Although it seems obvious why you'd want to do that right now, what about in a couple of weeks when you might be experiencing some bad withdrawal symptoms? Well, our brains are really good at ignoring the little angels on our shoulders telling us to stick through with something unpleasant in the short run because of how important it is in the long run. And especially when you're like in a cold sweat, you crave nothing more than to just have one cigarette. you want to remember how you feel right now. Right now you want to quit smoking. So help, that little angel on your shoulder by physically creating a list of all the reasons you want to quit smoking. And now each time when you want to pick up a cigarette, you can read your list and remind yourself of, the bigger picture of why you got to stick through with it.
So right now, if you're watching this video and you're determined to quit smoking, feel free to just whip out a notebook, a piece of paper, and just write down a couple of reasons for quitting smoking to inspire yourself, and tack it somewhere where you can see it on a daily basis when you need the motivation.
Yeah, exactly. So to, I guess, give some inspiration for that, so some general categories include health reasons, such as improving your health, lowering your risk of disease, or being able to have a child, and also health reasons for your loved ones, so not exposing your loved ones to secondhand smoke, and I talked about some of the negative effects of that earlier, and it can even be like financial reasons, like you really want to save money just to go on a vacation when this whole pandemic is over, or it can be for social factors like setting a good example for your children or your grandchildren, or just feeling more confident in yourself. And so now, feel free to pause the video and write down your reasons for wanting to quit smoking. And although we mentioned some general categories in the last slide, the more personal and specific you can get with your own goals, the better. So phrase them in a way that is meaningful to you, or in a way that you think would get through to you in a moment when your brain might be trying its hardest to convince you that your reasons aren't important enough to continue coping with withdrawal symptoms. So once you've decided to quit, choose a date to start. Ideally, this should be within the next 2 weeks, so you have enough time to prepare without losing your motivation to quit. However, if you, in addition to that, if you mainly smoke at work or on weekdays, then you could quit on the weekends so that you have a few days to adjust the change. Now, most people have the best success with quitting smoking by setting a quit smoking date and then completely stopping. But if you've already tried quitting abruptly a few times and it hasn't worked for you, you might want to consider starting the smoking cessation process by gradually cutting back on your smoking. So some ways you can do that include delaying your first cigarette of the day, progressively lengthening the time between cigarettes, smoking only half a cigarette each time, buying only 1 pack of cigarettes at a time, or trading 1 smoking break a day for physical activity. But the key with a gradual reduction strategy is to build on each success until you've quit smoking entirely. And if you have trouble, it's okay to change your increments slowly by a small amount each time, but just make sure that you're setting your reduction schedule so that you're staying on track with it and that you're working towards quitting smoking.
I've heard that there's a payoff, pros and cons for both, where if you quit abruptly, then you experience all the withdrawal symptoms and the cravings really intensely, but for a shorter period of time. But when you quit gradually, you end up experiencing cravings and withdrawal symptoms not as severely, but over a longer period of time. So it kind of depends on your preference.
Yeah, that's really interesting. I didn't know that, but it's for sure. That's definitely something that you should consider for yourself. So now that we finished talking about planning to quit smoking, we just want to point out that when we talk about quitting, we absolutely not talking about quitting without external support. And it's incredibly common strategy to just try to quit by yourself and have no external support. In fact, 90% of people who try to quit smoking try to do it on their own, but only 5% to 7% of people who try to do this strategy are able to quit on their own. So to make things easier for you, our next phase is dedicated to preparation, or in other words, identifying resources, medications, and social supports.
Oh,
so
right,
firstly, I'm so sorry.
Oh,
Go ahead.
No worries. I just want to double check this is my section. Okay, so Victoria's talking about some of the additional supports that you can have, and those supports could be social supports such as talking to your family and such, but it's also important to keep your healthcare team up to date. And when you talk to your doctor and stuff, you find that resources such as nicotine replacement therapy and medication end up becoming available. So we'll be talking a little bit about that. So nicotine replacement therapy, or NRT as it's commonly called, Basically, nicotine products, including patches, which are very, very common, gums, sprays, lozenges, there are a number of products out there, and they work because they contain nicotine, which is the addictive substance in cigarettes, but these products don't have the other toxic chemicals that are in cigarettes that actually lead to diseases. So they'll help you kind of wean off of cigarettes and experience, like you won't be experiencing those withdrawal symptoms as intensely if you use them, but you'll also won't be intaking the toxic substances leading to deteriorating health. And one of the common approaches is combination therapy. Combination therapy typically refers to using a patch in addition to one of the other ones. So a patch tends to be long acting. You put one on at the beginning of the day and it slowly kind of leaks nicotine into your body. But then occasionally you might have intense cravings. For example, if typically after your morning coffee you always smoked previously, you might experience those symptoms now. So when you have intense symptoms, that's when you would reach for a piece of gum or use a spray. Now, you might think that NRT can be very expensive, but when you consider how much money you spend on cigarettes each day, whether you smoke 20 cigarettes or 10 each day, the price is certainly very comparable to the price of NRT. So in a way, you'll be saving money in the long run, particularly if you succeed in quitting. So use the money that you usually use towards cigarettes and invest it instead in NRT or just in a future reward for yourself. But we understand that financial constraints are definitely a big obstacle for a lot of individuals out there. And so that's why we want to recommend the STOP program here in Ontario. So STOP stands for Smoking Treatment for Ontario Patients. It's a program that's run jointly by the Ontario Ministry of Health along with the Centre for Addiction and Mental Health. And here is the URL for the website. You can feel free to pause the video right now to check it out. And once you're on the site, it'll look something like this, and you'll notice that they are providing something called Stop on the Net. Previously, it was called Stop on the Road, an actual program that did go on the road and have workshops at different cities. But now, because of COVID-19, they've translated it into an awesome online-only format where if you register, you not only receive things like counseling, discussions, information, but you also receive 1 month of free NRT. So if you are experiencing financial constraints, we highly recommend you register for Stop on the Net and try it out. If you do prefer more in-person interaction, socially distant, of course, you can feel free to talk to your family physician about whether or not health centers near you are offering this program in person as well. Okay, and here's just an example. It's an old worksheet basically of what doctors may be consulting when deciding what kind of NRT benefits you, but this is definitely just an example. You should talk to your physician in order to confirm the best kind of nicotine replacement therapy plan for yourself, but it's just an example. So if you smoke maybe less than 10 cigarettes a day, then maybe you should be considering using a 14 milligram patch for almost like 2 months time, and then switching over to 7 milligrams so you get that gradual drop in the amount of nicotine, and they provide other recommendations depending on how many cigarettes you smoke, and then some other options as well for short-term NRT. Okay, some other supports if you desire some counseling or you're looking for more NRT. If you registered for the other program and you still need more, you can feel free to self-refer to the CAMH's Nicotine Dependence Clinic by calling this phone number. Just listen to the options. When I called, I believe it was option 2 and option 4. And then at the end of the line, you're able to self-refer for their nicotine dependence clinic. They'll have a screening call with you, and then you'll be registered and joining the waiting list. And once you're in, then they'll be providing you with more NRT as well as counseling services. If you're looking for something that may be a bit faster with providing support, then other than the Stop on the Net program, you can consider contacting Connects Ontario, where they can provide information about local services. So you can check out the website here, feel free to pause, or just give them a call and the representative will talk to you about services near you. All right, and let's not forget that medication can actually be a big support. Just remember to talk to your physician about the best option for you and whether or not you if it's financially feasible for you. So luckily here in Ontario, the Ontario Drug Benefit Program actually reimburses treatment for either of these medications, Zyban or Champix, for a maximum of 12 weeks each year. So you could talk to your pharmacist or talk to your doctor about how to get started on that. Zyban or bupropion it would normally cost $164 for those 12 weeks, but if you do, if you're part of the Ontario Drug Benefit Plan, then you would get all this for free. We know that Zyban is also an antidepressant, so it's a good choice if you have depression, and it may be covered by insurance as well, and versus Champix, which costs a bit more, $284 for those 12 weeks, but it's good at reducing withdrawal symptoms that you experience. So you could talk to your healthcare provider to see if this is necessary. You can try quitting without any of these supports, and then if necessary, tag them on, but just keep in mind that you should prepare for them and keep them in mind. Okay, so having talked about all that, you can take this moment to pull out that notebook, that piece of paper, and write down what types of NRT or medications you want to discuss with your doctor, which ones you think will suit your lifestyle. If you're on the go a lot of the time, maybe it's not feasible for you to always have gum with you, or if you're already on a lot of medications, maybe it'll be stressful adding another medication. You know yourself best, so just consider which type of NRT you feel comfortable taking and make sure to talk about it with your team. Also, make a note of the programs that we discussed earlier. Feel free to go back and just check out the URLs and try to register. And best of luck.
Yeah, so Winnie just talked about a lot of really good information for supports for quitting smoking. So I just wanted to build on what Winnie just mentioned about the counseling services that that CAMH provides.
Mm-hmm.
So this is something that you can access like not only through the CAMH, but also by talking to your physician, talking to your pharmacist, just general supports. But basically, like we just wanted to highlight that counseling services can be a really effective intervention to provide you with professional support outside of medications. And in fact, combining counseling and medication is one of the most effective ways to succeed with smoking cessation. So there are a couple different types of counseling services. So mainly there is individual counseling or group counseling. In both ones, you could get coping skills to address stressors or other triggers, strategies to deal with changes in mood, and education about the benefits of quitting. But if you're comfortable or if it's a more affordable option, then group counseling can also help giving you mutual support among people trying to quit, and you can share tips with each other on what behaviors or strategies are most beneficial. And we'll be including more resources on accessing counseling services at the end. So besides getting support from professionals, make sure that you tell your loved ones and the people you surround yourself with of your plan to quit smoking. So tell them that you need their support and encouragement to stop, and let them know how they might best support you. After all, they also want to see you improve your life and be happier.
Mm-hmm.
So some examples of things you can say or ask include telling them what day you'll be quitting, asking them to check in to see how you're doing, asking them to be patient with your changes in mood, and requesting that they don't judge or criticize you if you have a setback. And if you know people who smoke, then ask friends who do smoke to not smoke around you or to offer you a cigarette. Or if they want to stop smoking as well, you can even ask them to be a quit buddy. So in other words, you both, try to quit together, and you keep each other motivated and on track.
Mm-hmm.
Finally, you can also ask for their support, just any of your loved ones in helping keep you motivated and on track, such as by planning activities or outings with them to get your mind off of smoking. So this brings us to the pursue phase of quitting smoking, where you can plan for and identify ways to avoid and cope with the side effects of quitting, as well as stay motivated to remain smoke-free. So you might be wondering why we put a picture of dogs and food on the screen. Well, that's because this cute graphic here demonstrates a really important process known as classical conditioning. So classical conditioning is basically the process of your body learning to create an involuntary physical response when you're in conditions that are usually paired with something else. So in case you're unfamiliar with the original experiment of Pavlov's dogs, the process was basically as follows. So when a dog sees food, then it automatically salivates. Whether or not it's consciously thinking, oh, I want that food, the body is preparing to, eat food. And then let's say, Pavlov, he like blew a whistle and the dog has no response because, it's just a whistle. But what if every time the dog gets food, then a whistle is also blown? The dog learns to subconsciously associate uh, whistle, the sound of the whistle, with being presented with food. And so, because of that, every time the dog hears the sound of the whistle, then it will salivate. So, how does that tie into smoking? Well, for smoking, then every time you develop a routine of smoking, um, your your, I guess, bell
Hmm.
whistle would basically be being in a certain place or at a certain time where you usually smoke. You're classically conditioning your body to expect nicotine. And so, let's say you usually smoke after work in the kitchen. So every time after you come home from work and you go straight to the kitchen, you might feel more intense desires to smoke. So that's because your body is expecting to get a dose of nicotine at that time when you're in that place. So to counteract this, we'll be talking about strategies to avoid triggers, um, which would, elicit the response of your body's response of expecting nicotine, as well as ways to switch up your routine, and to make smoking harder for yourself, and to manage stress, all of which would usually result in more cravings to smoke.
Hmm. Okay, by the way, I think we're running a little bit limited on time, so let's try to make this concise so the video call doesn't end up ending.
Okay.
Just a little.
Do you know how much longer we have?
I'm not sure. I'm just guessing like maybe 7 minutes max.
Okay,
Yep.
no problem. Well, I guess so. There's a lot of different ways to avoid triggers and reshape routines. So the first one, or the most obvious one, I guess, would be removing cigarettes and other tobacco smoke products from your home, car, and work, and just anything that reminds you of smoking or something that smells like smoke. So throwing away all of your cigarettes, lighters, ashtrays, and matches, and washing your clothes, cleaning your home, anything associated with smoking or the smell of smoke. And if you know other smokers, then again, let them know about your plan to quit so they can also help you avoid triggers of smoking. And in addition to that, what we mentioned about switching up your routine. So lots of people make a habit of smoking when they drink alcohol or at the end of a meal or work day. So if you drink alcohol, then try switching to non-alcoholic drinks or drink only in places where smoking inside is prohibited. Or you can try snacking on nuts or sucking on a straw, anything to avoid the association of alcohol with smoking. In addition, oh sorry, yeah. So to make smoking harder for yourself, then okay, so this first strategy is something that Dr. Kearney really likes to emphasize, which is smoking with your non-dominant hand. So this is this is kind of like adding a step in your automatic process, and that might throw off your whole like automatic response. And we've listed a lot of other strategies on the slide, so we won't be saying all of them out loud, just because we're running out of time. But basically, making smoking harder for yourself and managing stress are both really good ways to help curb your urge to smoke or just make it harder to do so. And lastly, when you get the urge to smoke, you can also practice saying to yourself that smoking is not an option or I'm a non-smoker. And even practicing saying this phrase helps disrupt your thought process of automatically reaching for a cigarette. So we can do a practice of deep breathing. I won't take the extra minute to do it with all of you, but basically a good technique of managing stress is deep breathing. So you can breathe in for 4 seconds, hold for 7 seconds, and breathe out for 8 seconds. And this is a really good technique that can help ground you in the moment and reduce stress and anxiety. So although avoiding smoking triggers will help reduce your urge to smoke, you probably can't avoid cigarette cravings entirely. But fortunately, cravings don't last long. They're typically around 5 to 10 minutes. But if you are tempted to smoke, remind yourself that the craving will pass soon and try to wait it out. But it really helps to be prepared in advance to have strategies to cope with cravings. So overall, the most important thing, um, again, reminding yourself why you quit in the moment, but also distracting yourself can be really helpful. So, we have a lot of pictures of different things you can do, but basically, keeping your hands busy, or eating a snack or chewing gum, um, and can all be really helpful. In addition to that, an interesting fact: if you brush your teeth or chew gum, the just brushed clean feeling, or I guess minty feeling, can help a lot with cigarette cravings. And yeah, in addition to that, if you drink water or get active, that can also help with cigarette cravings. And finally, this one, if you're used to lighting a cigarette, what you could do is also light a candle or some incense instead, and then you also get some nice candle smells going on in your home. So finally, we really want all of you to know to celebrate your successes, because every single day, every single week, month, etc., no matter how small, of being smoke-free is another success. So, whether it's something like, oh, every week um, buy yourself, I don't know, like your favorite snack or something like that.
Mhm.
Or you can even ask your family, like, oh, every month I'm free of smoking. We should go out somewhere. Socially distance, but it is a valid strategy. And in addition to that, keeping a quit log is very, very helpful for tracking your progress and knowing your basis for celebrating your successes. So, keeping like a calendar of checking off every day you're smoke free, and also just setting milestones for yourself and being aware of how long you've uh, been successful in quitting smoking. So you can take a moment. You can take a moment to pause the video and find a place for you to keep track of your smoke-free days, whether that's a notebook or a calendar or a phone app.
All right, so we'll just be talking about some resources real quick. So there's the Smokers 24-hour helpline, there's the phone number, and the website. And the advantage is that it really has a lot of languages available. So if you do speak language, English is not your first language, or French, then you can feel free to check out this resource. They have trained coaches. There's also Quit Now, website is there, and Hamilton Quit Smoking if you're looking for something a bit more local. In terms of other resources, you can absolutely ask your physician or your pharmacist. They are healthcare experts, and they will be able to provide additional supports such as the NRT and the medications we discussed before, and other helplines if you're just looking for additional someone to provide an ear to chat a bit about your journey. We have Telehealth Ontario, Canadian Cancer Society's Smokers Helpline, and as well as some other helplines that you can call. And lastly, apps. We're living in a very digital age. If you're looking for something to help track and keep you accountable, then apps are great resources. Here are just a couple that we found that have good reviews. And a huge part of the quit journey is just keeping yourself informed and continuously being an avid learner. So we also listed a couple of YouTube videos that we find are great resources for individuals who are looking to stay motivated to quit smoking.
So we talked about a lot today, a lot of different strategies for a quit plan. So we've just synthesized all of them into this one screen right here. So if you pause your video right now, you can take a picture or a screenshot, or if you're on a laptop, this might be a little difficult, but if you press Control P, you can also print the screen. But if that's difficult, just take a picture. So finally, before we end our workshop today, we just want, there's like a lot of what is difficult for quitting smoking is, the thought of what if I relapse? Well, what do you do in case you do relapse? Firstly, know that relapse is really, really common. Most people who try to stop smoking fail several times before they kick the habit for good. So don't beat yourself up if you slip up and smoke a cigarette. And if you do slip up, then turn the relapse into a rebound by learning from your mistake. So analyze what happened right before you started smoking again, identify the triggers or trouble spots you ran into, and make a new stop smoking plan that eliminates them. And in addition to that, then a slip is different from a relapse. When you slip up and smoke a cigarette, just once, then that doesn't have to turn into a full-blown getting fully back into smoking. You can, as long as you try to get back on track as soon as you can, that was only a slip up and you didn't relapse. You're trying your best, and that's what really matters. And in addition to that, then consider seeking more support or using a more forgiving strategy. Again, part of the learning for next time. And finally, remember that one of these attempts will be the one where you quit completely. So never lose hope. Just keep trying.
Yeah, and just to end on a quote from Dr. Kurnu, he always emphasizes he doesn't really care if you fail at quitting smoking because it is common to relapse. Not everyone does, but it is fairly common. But Dr. Kurnu doesn't care if you fail, he cares if you end up giving up. So please care about yourself, care about your loved ones, and don't give up, okay? It's meant to be a hard journey sometimes, but that doesn't make it not worthwhile. It is worthwhile. It's going to benefit yourself and the people around you. So remember to keep having faith and keep going on that path. All right. Thank you so much for joining us today in our smoking cessation video. You feel free to contact us at the email listed here. Just take a picture or type it into internet. Gosh, English. And feel free to check out our website at drkurnu.com. Alrighty, that's everything from us today, and best of luck on your quit journey.